What are the gonads? Well, in the male reproductive system, those are the testes, and the female analog are the ovaries. And the sex cells produced in the men or males are the sperm, or spermatozoon is singular, spermatozoa is plural. And then we have the ovum or the egg in the female reproductive system, or ova for plural. And the hormones produced, yeah, so, oh yeah, and that's like a very good point that brought up in the chat. We tried to include as much of the proper anatomical terms for the reproductive system. So, but the thing is that the chat filter might be pretty strict. They block most of the slang, so try to use the medical terms if possible. And we tried to make sure unblock most of them, but there might have been a few that fall through the cracks. So, if it doesn't show up in chat, that might be it, because like the YouTube chat filter is kind of strict. All right, so then. For hormones, we have androgens. So androgens is not just a singular. There are multiple types of male hormones, and they're collectively called androgens, including testosterone, DHT, androstenedione, all of these types of androgens. And then you have, so in common lay person's terms, especially when people talk about the menstrual cycle, they like to say estrogen, singular, but actually estrogen is a category, not a single type of hormone. Usually they're referring to estradiol, which is the most powerful and potent type of estrogen in the female reproductive system in humans. There are other types of estrogens and other that have estrogenic activity, but estradiol is the main one. And same with progesterone and progestogens. Progestogens is a category, progesterone is the primary progestogen. So progesterone and estradiol are two of the very important steroid hormones in the menstrual cycle. But again, we are going to cover that next week. Alright, so then now we have to talk about the external genitalia. In the previous lecture, we learned about the male external genitalia. So of course, pretty obvious here, this is the penis, and this is the scrotum over here. And for now, we're going to talk about the female external genitalia. So the female external genitalia collectively are called the vulva. And what we have here is the structure. So mons pubis is sometimes called mound venus or venous mons. So that's what they're talking about with that, or pubic mound. And then we also have the clitoris over here. And then over here we have the urethra. So the urethra is not part of the clitoris, and it's not part of the vagina over here. This is the vaginal entrance. So again, there are separate tracts for the female reproductive system. The urethra is not located within the vagina. But again, like we saw in the previous slides, that a lot of people who haven't had good sex education programs in whatever schools they were in, they think women urinate through their vagina, which is not correct. And then what we have here, so labia majora and minora. So labia is a plural form. So here we have a pair of labia majora. These are the bigger ones on more lateral. And the minora, these are inner and they're relatively smaller. Okay, so then here's a sagittal view. So we're looking at a side view, and say we split a woman's anatomy right down the middle. And what we see here is, again, that urethra between the urinary bladder and the external environment, separate tract from the vagina and the uterus over here. So again, women do not urinate through their vagina. There's a totally separate tract there. And here we have the uterus and the vagina. Now we can go finally revisit top hat questions. I know it's been a while since we did that. So here's the question. Now that we see so what's this person or this little kitty cat doing? It's using the restroom, right? Say you're done doing number 2 and defecating, and which way should you wipe after using the toilet? So that's what we're getting at here. Which way should you wipe? Should you wipe front to back or back to front? Yeah, so which way do you go? Anterior to posterior or posterior to anterior? Which way is the most hygienic way? Okay, let's see the responses. And everyone's unanimous in what they responded. So everyone said front to back, and that is correct. That's more hygienic. But why is it more hygienic? Well, just look at the anatomy. So again, here we have, this is the clitoris. So what we have here is the glands of the clitoris and what we call the clitoral hood over here. And then we have the urethra, and then we have the vaginal entrance over here. But then we have the anus. So say you're done defecating and doing number 2. So what if you wipe back to front? Well, what do you have in your GI tract? You have all those bacteria, right? And remember my saying that good bacteria are only good if they stay where they're supposed to be, right? So what happens if you wipe posterior to anterior? Well, that's going to bring along those bacteria along for the ride, and where can it end up? It can end up at these entrances over here. So that's why it's, even though it's ergonomically easy to wipe from posterior to anterior, that's why it's more hygienic to wipe from anterior to posterior. So front to back is the more hygienic way, because again, you don't want these little things coming along for the ride. Now, who is more at risk of bladder infection? So another top hat question we have coming up here. So who's more at risk? So who's more at risk of bladder and urinary tract infections? Females or males? Men or women? Okay, let's see what everyone responded. So most of you said females and one of you said males. Now let's explain which sex is more prone to bladder and urinary tract infections. Well, what about men? Like, does it matter more for them to wipe from front to back or back to front? Well, if you're talking about the external urethral opening, well, to actually get bacteria from here in the anus all the way to the external urethral opening, men kind of have to go out of their way. They have to kind of like wipe from back to the front and somehow end up hitting here and grazing the external urethral orifice. So it's much more unlikely for a male to, unless they're really going out of their way to do that, the chance of them getting gut bacteria from wiping is less. But say that happens anyway. Say that someone does have gut bacteria and we have it at the external urethral opening in both males and females. Well, let's do a little race. Here we have the bladder, here we have the urethra in both the male and female body. And let's start the bacteria at the external urethral orifice. Now, who has the longer path? The bacteria here at the external urethral orifice of the female body or the male body? So let's do a little race. So notice that the urethral distance between the external urethral opening is a lot shorter in the female than in the male. Like in order to get a bladder infection, the bacteria have to go all the way up here. And again, this is why. Now, does that mean men are completely protected from bladder infections? No, not by the least bit. But again, this is why bladder infections and UTIs, urinary tract infections, are more common in females. And this is backed up by the reference. So what's the most common type of urinary tract infections or cause of urinary tract infections? Well, it's a bacteria called E. coli or Escherichia coli. So again, this is most commonly isolated from UTIs. And where do you find E. coli? You find it in your gut bacteria. So gut and feces. So this is why, even though it seems pretty elementary, that's why it's important to know which way to wipe in terms of being hygienic. This is a common cause of UTIs. You can prevent, now it won't prevent all UTIs, but it prevents this kind of careless sort of UTIs from just not knowing which way to properly wipe. So again, E. coli, this is a gut bacteria, and why is maybe people wiping the wrong way is a big reason why E. coli is the most common cause of UTIs.